Hi everybody, and welcome to the Engage Preceptor training. You will be logging in at the Engage website, which is engage.galencenterpd.com/login. Your email address is your logon, and your password has been provided to you. And once you log in, you will be asked to accept the terms and conditions of Engage, and then it will take you to your dashboard. All right, and it brings you to your Preceptor dashboard. If you already have a test transition nurse assigned to you, that's great. If you do not, you can select your transition nurses by clicking this button or clicking Manage My Assignments over here. Once you click in there, you can search for your person's name by typing the first few letters of their name, and you'll get some selections. Once you identify the nurse that you want to assign to your dashboard, just click this star by their name, and they're automatically assigned to your dashboard. And then you can click here, going back to your dashboard on the left, and you'll see your transition nurse. You can have multiple nurses you might be precepting. To click into the status page of a transition nurse where you will be performing your validation, you just click on the name of the nurse or view status. They'll take you to the same page. And this is the status page of your transition nurse. They have their hospital resources available, and you can access them as well. It takes you to a logon screen where you will use your username and password to access your health stream. The benchmark validation status is where you will validate benchmarks, and competency validation status is where you will validate competencies. Module progress is driven completely by the resident, and you don't have to do anything as a preceptor with these modules. Let's click into benchmarks and see how to validate benchmarks. You'll notice this big orange block right here, and that means that the first shift of this person is required on the floor. So you have to provide the first clinical shift. So I'm going to pick today, and I'm going to save this first shift. Otherwise, you can see I can't validate anything. Once I save this first shift date, you'll see that my validation buttons appear. The first shift date is important for data collection. It tells us how long it takes someone to move from their first shift to where they are productive independently managing a full patient assignment without a preceptor. So as a preceptor, you can click into these information boxes or click directly into the validate button. So let's go ahead and click into validate, and you will see your criteria listed to the right. And please note that we are trying to be very concise. So read through these and make sure that this is what you are validating of this resident. Your benchmark status is either in progress, validated, not validated, or there's an exception. Typically, you don't bother putting that it's not started. It's a waste of your time. In progress, if you're working on something and need some more time, or just validated if it is validated. You will only select not validated if there is a serious concern about this resident and you don't think they can move forward. So that is rarely ever used. And an exception is used when one of the criteria is not required for this individual person. It's also rarely used. So let's go ahead and just validate this because it was the shadow experience and the effective date. We do not have any predefined notes. You have many of them, but I'm not going to select any predefined notes. I can add notes if I like, and I can also attach a file. Typically, you don't do these things. You can then finally select all if you choose to, and then save that validation. And you will see that it was validated by me, and it is validated and the effective date. Let's go into another one that's going to likely take several shifts, medication management. So if we go into this, I want to make sure that my resident can access all of their resources for their self and their patients, which my resident can do. They use their informatics to find information required to administer medicines. They do appropriate label medication. So I'm going to say that this resident is in progress, and there's only one thing that we really need them to continue to do better or continue to master, if you will, as competent. And so I will save these, and you'll notice that it's in progress. Now I'm going to show you how precepting can be done without benchmarks and has in the past, just to kind of solidify how your benchmarks can be used to guide your conversations with your residents. Take a look at precepting without benchmarks.
Hey Joanna, how are you?
Yeah.
Okay. This is Maria. She was supposed to train with Renee today, but she called off, so I'm going to have her work with you. I know you do have a busy assignment, but I'm pretty sure the two of you will be able to get this done together. But if you don't, let me know and give me a call, okay?
Thanks.
You're welcome. Bye. Thanks.
Hi, I'm Maria. Hi. Yeah, I'm Joanna. So, listen, I didn't know you were going to be here with me today, so, what do you want to focus on?
Well, last week I had Renee. She kind of told me to follow her around, and, you know, we kind of learned as we went.
Okay. All right. Well, why don't you just follow me?
Okay.
All right. You know, if you have any questions, ask me.
Okay. This is only my second day, so.
Yeah. Well, just follow me, and then you can pick back up when Renee comes.
When Renee comes back? Okay.
Yeah. But
Okay.
we have a busy assignment here,
Okay.
so we need to get moving.
Okay.
All right. Yeah.
Okay, so that's what it looks like without benchmarks. Let's take a look at what it would look like with benchmarks.
Joanna, how are you?
Oh, I'm great.
Good. This is Maria. She is coming here today. She was going to be orienting with Renee, but Renee called off sick.
Okay.
Is there any way I could let her work with you today?
Oh, sure. Yeah.
Okay, great. Thanks.
Yeah.
I know you have a very heavy assignment, but I'm thinking together you can work on it.
Mhm.
And if you're running behind or there's a problem, please let me know.
Okay.
Thanks.
Thanks.
Okay.
Thanks, Lisa.
Bye.
Hi, Maria. I'm Joanna.
Maria, it's very nice to meet you.
Awesome to meet you too. So tell me, how much clinical experience have you been here on the unit?
Oh, this is going to be my third day.
Okay. And your third day. So who is your regular preceptor?
Regular preceptor was Renee. She was
Renee?
really nice.
Yeah. She was my preceptor when I started.
Oh, really?
Mhm,
Oh,
mhm.
cool.
All right. So, last time you and Renee worked together, did you all work on your goals for the next time?
Last week, we did the NDR benchmarks, and she signed
Okay.
me off on my shadowing experience. So this week, we were going to focus on documentation and assessing.
Ah, perfect. Okay, did you have a chance to review the criteria?
I did last week.
Oh, awesome. Okay, well, let's take a few minutes.
Okay.
Let's review the criteria one more time.
Okay.
Okay, let's pull this up. Okay. All right, so, well, you know, we do have a heavy load.
Okay.
So what do you think about performing all the assessments
Okay.
on all of my 5 patients?
Oh, perfect. Okay.
And then we'll practice your documentation on 2 of them.
2, okay.
Right, so, and then I'll be able to review it with you, but, you know, this way we have a heavy load, we can still get the job done, but you'll be
Perfect.
next to me and we'll work on everything together. That way you can still get your practice in.
Awesome. Okay, 2 of the 5. Got
Okay,
it.
yeah, and this way you can see how I manage the entire assignment.
That's awesome. That's a good plan. Cool.
Maria, I want you to pay attention to how I delegate to the UAPs.
Okay.
And definitely how I prioritize. So this
Okay.
way then you can make this a focus when Renee comes back.
Okay, perfect. That sounds
Excellent.
awesome. Thank you very much, Joya.
You ready to get started?
Yes.
Let's go.
You can see how benchmarks gives a language to communicate what your expectations are. So be sure to really pay attention to the criteria, communicate that with your resident, and help them understand you're really trying to help them manage the full patient assignment by using these benchmarks. Okay, so let's go back to the transition nurse's status. You can click right up here on their transition nurse name, or again to the left and go to status. So now you can see that we have 1 of the 11 was complete, the shadowing experience, and that we're working on the medication one. And so it does show you a real-time progress, as well as the nurse educators, your nurse leaders, nurse managers, all of those will be able to see this in real time. So let's click on into a competency. Let's say we're going to do alarm management and validate that our resident understands alarm management. So I'm going to go ahead and click in. And you'll notice you have more things to select from here because competencies are different. These are actual skills that you're evaluating in practice. So with this alarm management, I'm going to evaluate if my resident has met all of this criteria. So I'm going to evaluate all of these. I'm reviewing this. I've already reviewed it with my residents, so I'm sure that this is all correct. I select them all. Then you'll come over here to the competency status, and for alarm management, it's going to be validated. And your institution can select from all of Donna Wright's evaluation or validation methods. In this situation, I'm going to use evidence of daily work because this nurse manages her tele patients extremely well. The level of performance is competent, and then I'm going to save my validation. And you'll see that it is validated, and it shows that all the criteria is met. Let's go back to the status page of our resident. So you'll notice that the alarm management is completed and it's finalized. Now let's go into catheter-associated infection. If I click in to validate this competency, you'll see this sign, this notice, and it says that the user must complete a self-assessment before you can validate. So if you get this message, it just triggers you to tell your resident they need to go back in and do their self-evaluation. So let me go back to that status page, and I'll show you again. This competency was what we were in, where they had not done their self-assessment, but you'll notice that the resident did do this, and it shows in progress because the resident did complete their self-eval. So I'll go in as the preceptor. We've been working together for a while, and I've reviewed all of the criteria with my resident, and I am selecting that it is validated. Again, evidence of daily work. We're using our PPE every day with our precautions, and this person is competent. Save the validation. And it gives you the summary of that. And your hospital resources is already attached to this, and there is a procedure for MRSA screening already attached to this competency. So let's go back to the status page again, and you'll see that this is finalized, and not started again. And that's really all you have to do as a preceptor, is validate benchmarks, validate competencies. And then let's just take a look at your left-hand screen here. The status page just takes you to this page, obviously. You click, you're just right here at your status page. Details can give you more information about your resident, their nursing license, education. Some of this is filled in. You can see when they logged in last. And you can go and add a note if you'd like to. Click on notes, and you can put a new note. You can put the subject, debriefing meeting. Don't forget the debriefing meeting on 5 South at 5 p.m. today in the conference room. And you can choose a file if you want to add something to this, and you can save your note. Then you go back to your status page, and that's really all there is to it. Good luck to all of you, and stay well.